the 5 North Santa. Very jovial guy, odd sense of humor at times, definitely captured the hearts of all of us on the floor and grew on us very quickly. Loved to make everybody laugh and did his best to make our time in his room as enjoyable for us as he could.
He had his computer. Do you remember all the pictures on his computer of he dressed up as Santa, and he was Santa.
He initially came to the hospital with an infection, and we had taken care of it and sent him on his way, and came back within the week and was having other issues that were unrelated to the infection, to find out that he had cancer. And so we worked on treating him for his cancer. And then after the end of the course, they found that it was completely unsuccessful. And then the patient ended up on comfort care on our floor and was there from the beginning or the middle of October until the very beginning of January.
For the remainder of his life.
Yeah. So, and he had planned on leaving town to go do his Santa role out of state that he did every year, but was unable to do so. And we adopted him. And we decorated his room. I know that somebody had hand knitted him a hat, which he wore. Somebody had brought him some moccasins. Deb had brought him some moccasins. People had made him some homemade food items. Yeah, favorite foods.
I'm sure there was candy involved.
Yeah, I brought him chocolate.
I'm sure there was candy
Yeah.
involved.
I remember him from his sense of humor and that these two talked about, but after he was made comfort care, it was a more serious atmosphere, and it was kind of more that I was happy to be there to support him when he needed us to. That was what was most meaningful for me, was to be there. Like, I was the one that started his morphine drip when he decided that he was ready to transition towards end of life, and like the day that he signed his will, and his couple of friends were there, and it was really serious, but I was glad to be part of it because it's a life-altering experience.
I remember clocking out one morning and making sure I had breakfast before I went into his room. And I just sat down with him, and I got to show him the love of Christ, which was great. And I just sat there, and I remember him trying to grab his cell phone, and he was so weak and so shaky that he couldn't even dial on his phone. And so I just sat there with him. And I can remember grabbing onto his phone and said, "Who am I calling?" And he had a difficult time initially remembering some people's names, but we worked it out, and I dialed the phone for him. And we attempted about 10 different phone calls, and he reached about 5 or 6 different people. And he was calling to let them know that he was dying. And I just felt honored to help him in that, because I know that it meant a lot to him to call the people that he loved and talk to them and kind of say his final goodbyes.
He also gave me a shirt, which I thought was really sweet. Monty came to visit him when he was in the hospital.
Oh yeah, I forgot about that.
He gave me his shirt signed by Monty, and so I still have that shirt, and it's way too big for me, but I didn't know what to do with it. But I'll never forget him. He was a very special person. He was poor and vulnerable, didn't have any family that was around. He was estranged from some of his family, and he didn't have very many belongings and didn't really have anywhere to go. And I don't know.
We just stepped in, yeah. Yeah. And it fits right in with the mission. You know, he was anticipating healing to some degree. And when there was no sign whatsoever of his cancer responding to the treatment, I think all of us just felt the heaviness of that. And so it's just easy to be compassionate at that point when you could feel that heaviness with that person. We tried to decorate the room with him sleeping in hopes that he would wake up when it decorated, but he caught us red-handed.
Well, he is Santa after all.
Right.
You can't sneak around Santa at Christmas time around a Christmas tree.
since
Yeah.
I've been on day shift, what's made me feel even better about my job is talking to patients and their family while they're awake during the day compared to night shifts. And I hear amazing things about all of our staff. And these people are in the same four walls for days and weeks and sometimes months at a time. And so they literally see all the differing people in and out of their room. And when I can hear somebody on the receiving end say, we can tell that everybody loves their job, we can tell that you guys take really good care of your patients. How can we thank an entire floor? People are asking us to thank individuals, but how do we thank everybody? And it's those types of comments that make me feel good about where I'm at, because I know the type of care that I desire to provide. And it makes me feel really good to see that they see it in everybody.
Well, it all started in Minnesota, where my girlfriend and I grew up, and we're both outdoor enthusiasts. A lot of the things I was into were more of the adrenaline side of stuff. I was a pretty big fan of getting scared. That led me into what's called speed flying. And speed flying is, it's very similar to paragliding, where you hike to the top of a mountain. It's all about speed, flying close to things, and more of the in-your-face action, so to speak. On August 13th, I was speed flying solo on Mount Jumbo. I was up about 200 feet or so and had some complications with my canopy and went down extremely hard and fast and landed on my back on the side of the mountain. Luckily, there was a man up there. He was able to get to me right away, which was truly what saved my life, because I should have died from the fall itself. And he was luckily able to call for a life flight to fly out to the mountain, and they hiked up there and got me off and flew me to St. Pat's, where it was in critical condition.
I got my phone out, it was charged, and I could see I had 3 missed calls from a 406 area code that was a number I didn't recognize. And I called the number, and it was messages on there from a hospital. And so listening to the messages, they were fairly detailed as to what had happened, that Joe had fallen and had gotten hurt and was in the hospital, was in intensive care, and that we needed to get out there as quickly as possible. So we very quickly threw our stuff together and got in the car and started heading south to Minneapolis. By the time we actually landed in Missoula, it was 7 p.m. and probably about 7:30 when we got to the hospital to see Joe. The entire trip was unnerving, because we had everything we had already news we had already received from the hospital. They had said to us he was a quadriplegic. That only meant one thing to us, and they had been very clear to us about how hurt he was. He recognized my wife, he recognized my daughter, but then shortly after we got there, they had to put him in an induced coma. And so we didn't, we did not get much time with him knowing we were there. And then he was in an induced coma for 4 weeks. So it was a very, very, I guess you could say in a way we were blessed to have even a moment with him prior to not being able to communicate at all for 4 weeks. A friend of Joe's is a nurse at the hospital. He works at ER, and he also was a speed flyer. And so he obviously knew about Joe's accident, and he knew that we would be coming there. And so he arranged a room for us at St. Pat's House. And we didn't know anything about St. Pat's House. I mean, we didn't know what we were going to be walking into there either. We had never been to Missoula, so we knew nothing about that town. And it was all going to be strange to us getting there. But when we got checked into St. Pat's House, I mean, we've never been made to feel more welcome anywhere in our lives. I mean, it was an amazing experience from that aspect. I mean, they made us feel welcome right away. They put us in an amazing room.
And at a time when nothing in our world was normal, just being able to leave the hospital for an hour or so and walk back over to St. Pat's and do something as normal as laundry right there. And it just, it just could kind of just made things feel as much like home as possible.
You know, it's as close to home as you could ask for being in that situation. And being that close to the hospital was incredibly helpful for us. I mean, we couldn't have asked for anything more. And everybody there, every worker in that place was amazing. We never left there that somebody didn't greet us in the kitchen and ask us how Joe was doing. We never returned from the hospital that somebody didn't greet us in the kitchen and ask us how Joe was doing. Other people that were staying there that had their own issues to deal with constantly were asking us how Joe was doing. It was amazing how much of a family environment that house becomes almost instantly for people when they walk in the door. It's like everybody just senses everybody else's needs. It's an amazing place.
My recovery has been really amazing. You know, I'm still in the chair, but as far as like being alive and healthy and you know, being at the point physically that I'm at has been quite the recovery. St. Pat's House was definitely a huge support for my whole family.
The girls on 4 South they put together a silent auction fundraiser in my name in order to raise money to help me pay for the medical costs and my time off from work that I'm going to have to take and won't be able to cover with my earned time and things like that. I know that there was a ski package. Some of the nurses put together gift bags and wine baskets, and I know there was a lot of restaurants, local restaurants in town that donated gift certificates, and car dealerships donated oil changes and things like that. Just a lot of different random things from the Missoula community that was donated. It was great. I think that our community here in Missoula is different from anywhere else just because we are it is more personal when it's one of your own that's diagnosed with cancer, and not just my coworkers that have reached out to me. It's just been everybody along the whole end of the spectrum, from the Women's Center to Dr. Picard's office to my chemo doctor, Dr. Reese. Everybody has just been wonderful to me, and it's really meant a lot. I wouldn't have chosen to get care anywhere else. I just wanted to take this opportunity to thank everybody involved and all the immense support that has been reached out to me through my coworkers and the whole hospital itself. Everybody from the pharmacy to everybody that has been part of my medical plan has really been a great amount of support, and I really appreciate it. It makes a really hard time that much easier for me.